So it's with great pleasure I introduce Catherine Mac Phail. Catherine is Senior Lecturer and, let me see if I can get this right, Catherine, Academic Program
Director.
Program Director
Yep.
of Postgraduate Public Health at the School of Health and Society and Health at the University of Wollongong. Catherine's particular area of interest is in adolescent health, both here and in South Africa, and particularly through a sort of social determinants lens with a particular focus on the intersection of gender and poverty and education. So thank you very much for coming, Catherine.
I was just saying that every time I come to UNSW for one of these seminars, it pours with rain, so there's going to be a massive storm just now, because there always is. Thank you for the acknowledgement of country. I would also like to acknowledge the traditional owners of the land that we're meeting on. And I just wanted to mention that just the work that I'm talking about today also is done in the context of an adjunct position that I have with the Wits Reproductive Health and HIV Research Institute, which is a research institute associated with the University of the Witwatersrand in South Africa, and where I worked before I moved to Australia from 2003. So what I thought I would do today is talk about a body of work that I've been involved in sort of over the last probably 10 or so years. I have to remind myself all the time that it's been that long. And so obviously I didn't do this work on my own. And I specifically wanted to acknowledge some of my collaborators that I worked with, particularly Audrey Pettifor, who's based in the Gillings School of Public Health at the University of North Carolina, Kathy Kahn, who is one of the heads of the MRC Wits, it's got quite a name, it's a mouthful, the Wits Rural Public Health and Health Transitions Research Unit, which is also, Kathy's based in public health at the University of Witwatersrand as well. And then Mandy Celine, who was our project manager, Namtle Khoza, who was my qualitative manager on the project, and I'll talk about some of her work because she's getting ready to submit a PhD, so I'll talk a little bit about her work in this context. And then also the broader HPTN 068 team, which was, HPTN 068 was the project that we did funded through the HIV Prevention Trials Network. And then especially, obviously, the 4 ladies who made up my qualitative team and who conducted all the qualitative interviews and collected the data that I'm going to be talking about. So during the early 2000s, I started working for an organization which at the time was called, I can't remember, the Reproductive Health Unit, I think. And then it became an institute, so we became the Wits Reproductive Health and HIV Research Institute. And one of the things that we were involved in was that it was at a time when it was becoming obvious that HIV was going to be a significant challenge in South Africa. And a national program was launched called Love Life, which targeted young people. And it was a mass media campaign, but it also had elements of getting young people into youth centres, which were called Y centres, to give kids things to do. They were involved in sport, but they were also involved in sort of community radio. They were involved in drama, and everything that they were involved in had some element of HIV education in it. And the Wits RHI was commissioned to do the evaluation component of Love Life. And as part of that, we did a nationally representative survey of young people. And it was one of the first sort of population-based surveys that had been done with young people in South Africa. And we surveyed just under 12,000 young people and sort of started looking at what HIV prevalence looked like for young people. And as you can see, it was really high, a peak prevalence for young women of over 30%, and that it increased really steeply. So we went from almost no infection at age sort of 14, 15, where girls were mostly not sexually active, and then a really steep rise for young women, not so much for young men. Men's peak HIV prevalence would be somewhere off here, off the graph. We only sampled up to age 24, but men's peak prevalence sort of probably 10 years later. And as you can see, that where we get to a prevalence of around 30%, we're looking at female HIV prevalence rates that are about 4 times those of their male peers. And so I think it's particularly important to note here that these really high levels of HIV infection are not associated with high levels of sexual activity. So we're not looking at a population who are massively sexually promiscuous. We're not looking at a population who engage in unusual or particularly risky sexual behaviors at all. And indeed, we did a national comparison using this data and comparing it with some national data collected in the US, where we could see this massive difference in HIV prevalence, but actually that US adolescents had more partners, more risky behaviors, less protected sex, I think younger age of sexual debut, I can't actually remember completely. Anyway, so we started looking at this data and thinking, well, what are the things that are associated with HIV infection, and how might we start looking at ways to intervene and to impact and to try and protect young women from HIV infection. And so when we had another look at the data, and we looked at the data only for young women who were already sexually active at the time that we did the cross-sectional survey, we found that about 50% of them reported only having one sexual partner. And if we looked at that 50%, we found that 15% of those were already HIV positive. And so while we acknowledge that there might be and are biological reasons for young women's particular vulnerability to HIV, we were also interested in the structural and behavioral factors that might also account for risk. And we were certainly doing this at a time when we'd moved in HIV from thinking about high-risk groups to thinking about high-risk behaviors, and then to thinking about sort of structural and contextual issues and how those broader issues might impact on risk. So we examined a range of underlying determinants around young women's risk, and found that it was age and education really that was significant in terms of HIV infection. So we expected age. As women age, they're more likely to be sexually active, so they will have been sexually active for longer, and so we expected to see the age. Obviously, we can't intervene in age, but we can do something about education. And so that's where we started focusing our attention. And we weren't the first people, we weren't the only people who were looking at the impacts of education as a protective factor against HIV infection. And so this is just one of many examples that comes from a longitudinal study that's been conducted in Uganda over time. And across the bottom are the rounds of data collection. Green are people who have completed secondary school, blue, no education at all, and the pinky color, primary education. And so that you can see HIV infection levels declining among more educated people. So we know in sub-Saharan Africa that young women leave school early, more often than boys do. They're the people who take on the burden of family responsibilities. They're the people who often fall pregnant, although there's a fair amount of, I think people felt that everybody, the relationship between pregnancy and school dropout was that young women got pregnant and dropped out of school, and actually what we're seeing very often is young women drop out of school and then become pregnant. But also that when it comes to resource-constrained families, often choices are made to leave young boys in school and to take young women out of school. And despite the fact that many South African schools are actually free, you don't pay school fees, they do leave, because young women particularly do leave because of poverty, because they can't afford transport to get to school, they can't afford the uniform to wear while they're at school, and they can't often afford the food to keep them functioning at school. So at the same time that we were looking at this, this sort of information around education, there was an upsurge in interest in social grants. And there was a lot of data coming out of South American countries where social grants have been paid for decades, particularly in Mexico and Brazil. And those social grants provide a safety net for the poorest of the poor. Some of them are unconditional. You get the money based on a means test. You don't have to do anything to get that money. Others are conditional, and they're often conditional on what are called co-responsibilities, where families are expected to do something that's for a social good. And so it's usually keeping your children in school, ensuring your children are vaccinated, ensuring your children go for clinic visits. So we thought, well, could we use social grants as a mechanism to try and keep young women in school as a way to protect them from HIV infection? But we were also really aware at the same time that, yes, there were these broad contextual issues around education and poverty that were impacting on young women, but that young women were frequently in relationships with young men. And so obviously we couldn't ignore the fact that gender inequalities were also playing a role in young women's vulnerability. So we were particularly aware that there was a growing literature talking about young women's vulnerability in terms of violence in sexual relationships, transactional sex, and then also the dynamics of having much older sexual partners than themselves. Because you'll remember I said in that graph that the peak for male infection was much later than for young women. And so there was, at that time, increasing discussion about the role of sugar daddies and transactional sex and the role that that might play in young women's risk. So I don't want to belabor the epidemiology part because I want to get to the qualitative part because that's what I have focused on, and the epi's not my stuff. But what we did was that we implemented 2 intervention projects in parallel in a community called Agincourt, which I'll talk about in a moment. So we looked at, could we use a cash transfer program to keep young girls in school if we conditioned it on school attendance, and would that allow us to prevent HIV infections? And then could we implement a community mobilization program which looked at focusing on HIV risk behaviors and also the role of gender inequalities? And we wanted to focus that community mobilization program on young men who were going to be the partners of the young women we were interested in. So this is just a sort of really basic table to talk about it, that we randomized young women individually. So the CCT is a conditional cash transfer. So we had young women who received the cash transfer, young women who were in the control arm who did not. And at the same time, we randomized the communities that they lived in to either receive a community mobilization intervention or to be a control for a community mobilization intervention. And so what we ended up with was these 4 different cells. One cell where we had young women receiving the intervention and the community getting the mobilization, one where no one was getting anything, and then people, young women getting the cash transfer only, and the community getting the community mobilization. So within these randomized control trials, we were looking at, in the cash transfer arm, we were trying to have an impact on incident HIV infections, and that hadn't been done before with a cash transfer study. People had looked at prevalence, but they hadn't looked at an incidence study. We were also looking at incidence of HSV2, school attendance, and then a range of different sexual behaviors. And then within the community mobilization, we were looking at outcomes related to the Gender Equitable Men's Scale, which is a scale that measures gender equitable norms. It's called the men's scale, but it actually gets used with men and women. So we administered that in 2 cross-sectional community surveys to men and women. I'm not going to go too much into the results of the interventions. What we found was that the cash transfer intervention did not have an impact on HIV. But what we did see, we saw really high school enrollment across both arms, which was much higher than we'd expected, and from the research that we'd done before we started the study, was much higher than we'd believed would be the case. So we didn't see an impact on HIV incidence, but we did see that across both arms, young girls who either dropped out of school or who did not attend school, the 80% which was required to receive the cash transfer, they were more likely to become HIV infected. But it did have an impact on young women reporting intimate partner violence in the last 12 months. So we saw reduced intimate partner violence, and young women who received the cash were less likely to report unprotected sex. And then in the community mobilization study, we found that there was improved gender norms among men in our intervention communities, but not among women. And we found that women reported a lower number of sex partners in the intervention communities, and that their experience of intimate partner violence was lower, although not significantly, than in control communities. So not the results that we had hoped for, but that's what we ended up with. So we did this work in a rural community in Mpumalanga province in South Africa. So this is to the east of South Africa. This is the Kruger National Park here. And this is a collection at the time that we started of 22 villages. I think it's up to about 28 now. They've expanded the reach of this site. And it's a demographic health and surveillance site. It's been in operation since the early 1990s. Does an annual survey of health. And it was really, it was put in place to look at health systems issues and to look at epidemiological transitions in the early 1990s. So it's an area of quite high levels of poverty. This is a traditional homeland, which was one of the strategies that the apartheid government used to enforce racial segregation. So they established a number of homelands through South Africa, which were ethnically divided. So this one was the homeland of the Shangaan people. Shangaan people live in Mozambique, which is over here. But there has been mass movement, and there have always been Shangaan people living in South Africa as well. So it's a largely Shangaan community. It's an area that has limited employment opportunities. There's some employment opportunities in the national parks. but relatively limited. And so what we have here is an established cyclical migration system that traditionally men, but more and more women as well, leave these rural areas and go either to mining communities where they work in the gold and platinum mines, or they go through to the big cities to work for women, often as domestic workers and other various jobs. So high levels of poverty. Although plots of land they're not tiny, they're not big enough to support subsistence agriculture, and the area has poor soil and is relatively dry as well. So it's not an environment that supports subsistence agriculture. So as part of this broader sort of clinical trial setup that we put in place, we also developed qualitative cohorts, both for the cash transfer study and for the community mobilization study. And I'm going to talk today really just about the young girls who are in the cash transfer qualitative cohort. We wanted to have some sense of what was happening to young women receiving the grant, and we wanted to try and understand how they felt that the grant was impacting on their sexual behavior and on their ability to protect themselves from HIV, or more generally, not on their ability, but to change the context in which they were living to prevent HIV infection. So when we started the study, there were a lot of concerns about the fact that we'd made the decision to pay the cash transfer directly to young women. So previous to this study, I think there had been some cases where adolescents in South America received social grants directly, but in general, social grants are paid to the female heads of households. And the reason it goes to women is that the research and the evidence seems to suggest that when the money goes to women, it gets used for the greater good of the household more often than when it gets paid to male heads of household. And so there was quite a lot of concern in the sort of social grants community and in the HIV prevention community that we were going to be making young women vulnerable by giving them money, because we paid 300 Rand a month, which is about $30. Well, it wasn't $30 at the time, it's now $30. And 200 Rand went to the the female parent or guardian in the household, and $100 went to the young woman who was actually participating in the study. And so the sort of disquiet about giving young girls money was something that was really in the news in South Africa at the time, because South Africa has a really large social grants program that already exists. They have something called a child support grant, which is means tested, and pays money to families living in poverty to assist them with the costs of rearing children. And during the time that we implemented this study, the age that child support grant got cut off was extended up until 18. It was always intended to expand, and so it expanded up to age 18. What's interesting about the child support grant is that it does actually have the wording in the legislation that guides it to be conditional on school attendance, but that element has never been implemented. I think that there probably just isn't the monitoring system available to ensure that happens. So there's been a lot of concern about the child support grant. Lots of stories that young girls are going off and getting pregnant on purpose to access money, because everyone knows that $30 a month is plenty of money for supporting a child. And there's been numerous studies that have shown, the evidence shows that is not the case, it's not happening, but there's sort of a hype in the sort of in media and in the sort of community culture that young girls are getting pregnant to access the child support grant. And at the same time, at the time that we did this work, there was a growing materialism in young people in South Africa. So there was the growing idea of the symbolic value of material goods or consumer goods in a society where those things were what you could access to develop a social identity and to position yourself in social networks. And so on the one hand, there's a fear that young women were putting themselves at risk of HIV, but also teenage pregnancy to access this money, and also this sort of recognition that young people were obsessed with consumerism and with what they looked like, what they dressed, how they dressed, and those sorts of issues. So there were also some concerns about paying young women money because of what the social consequences might be. So there were some fears that we would make young women vulnerable to coercion and potentially violence from their sexual partners or from adults in their family, and that they would be targeted. People would steal their money from them and target them. And so One of the things that we tried to do in this qualitative cohort was to look at some of the social outcomes or the social consequences of giving young people social grants. And Nomhle Khoza, who I mentioned, who was my qualitative manager on the project, she's in the process of finishing a PhD, specifically looking at the social consequences of cash transfer provision. So she's used data from this study, and then also data from a comparison study that we did in Johannesburg, which was with young urban South Africans, and that was sort of a pilot to think about providing different kinds of cash transfers. We had one arm that was conditional on school attendance, the same as here in Agincourt. We had one arm that was conditional on visiting a clinic for a sexual health or reproductive health visit, and then we had one arm that was unconditional, and that was done with boys and girls because there was increasing discussion about should we be extending social grants to boys as well. So she's in the process of finishing off her PhD. We're hoping to have that finished sort of early next year, and she's got a couple of papers that have already been published and a few that are on their way at the moment. So she used the interviews that we did with young women, but she also used interviews that we did with peers, young male peers, parents, and teachers who were involved in the study. So in the qualitative cohort, we tried to interview young women 6 monthly. So most young women could be in the study until they finished high school. So potentially when we started, they were aged 13 to 20, and they remained enrolled in the study for the 3 years of the study or until they aged out and left school. And so we tried to interview young women every 6 months. We had a team of 4 qualitative interviewers who established relationships with young women. We set them up that they always interviewed the same young woman, so that they had the background information from the previous interview, which they obviously reviewed as well before going out for a new interview, but also that they developed some sort of rapport and relationship with the young woman. We focused particularly on social experiences and impacts, on social relationships, what the cash transfer meant for young women, how it impacted on social identities and on social networks. So as young women aged out of the qualitative cohort, we tried to replace them so that we kept a sort of fairly robust cohort functioning through the duration of the study. And what we did was we purposefully sampled either girls who matched the girls who had been already aged out. So we particularly tried to purposefully include young women who were sexually active, because we had a lot of 13-year-old girls in the cohort at the beginning of the study who weren't yet sexually active. So we were particularly interested in getting young women who were sexually active. And then as the study progressed, using the quantitative data, which we collected annually, to try and select women into the qualitative cohort who we thought might be particularly interesting. So particularly young women who reported transactional sex, particularly young women who reported being pregnant, and women who reported dropping out of school during the time that we ran the intervention. And so what I wanted to talk about here was just some analysis that we did. It was a mixed method analysis looking at some of the quantitative survey data that we collected every year, but also looking at this longitudinal qualitative data that we collected. And what we wanted to try and understand was what young women were spending this money on and what meaning it had for them. And so from a quantitative point of view, we had just over 1,000 HIV negative women. So I'll just mention quickly that if girls were found to be HIV positive at the baseline, we didn't exclude them from the study because we felt that that would be a signifier to people in the community and would involuntarily disclose them. So young women who were positive remained in the cohort. So we had 1,209 HIV negative women at baseline. And we looked at we asked them, what did you spend the money on? And across 78% of visits, young women spoke about their experiences of spending the money. And so the first bullet point, we asked particularly about who made the decision. Was there coercion involved? Were other people involved in the decision making around the money? And how autonomous were they in spending the money? And what we found was that 78% of visits, young women talked about them being the one in control of the money. They made the decisions about how it was spent, they made the decisions about when it was spent, and they made the decision about how it was spent. Across 18% of visits, so women could choose more than one category. Across 18% of visits, women did talk about having some input from another adult in the family, and it was usually a mother, but largely an independent, autonomous decision. In the qualitative work, we asked about coercion and feeling forced to spend money on items that they didn't want to spend on. And we found that we had almost no reports of young women being forced to share their portion of the money or being coerced into spending it in a particular way. And in fact, what we found was that across families, there was a marked level of autonomy that families gave to young women in terms of this money. So it was very much seen as the young woman is the one who has to attend school to receive the money. It's her money. She's earned it. And so in some families, we also saw that parents gave the additional 200 Rand across to their daughters as well. So in some instances, they received the full 300 Rand. The other thing that was interesting, given that this is a community with high levels of poverty, and just to give you an idea, 80% of the girls in our study were receiving the child support grants, so met the means test for poverty, for social grants. And I think it was about a third mentioned food insecurity. We had a question in the survey that asked how many times in the last month have you been to bed hungry? And we had 30% reporting food insecurity. So these are not households where it would be easy to give that level of money away. But we found that there was no expectation in the households that these young women would contribute their money towards household expenses. We had no instances of young women saying that they contributed they were forced to contribute to groceries. Some of them did voluntarily. And so we wonder, was this because we had this household portion of the cash transfer, so we were already putting money into the household, or might it have been that there was recognition in households that these young women needed some form of financial autonomy, and that the cash transfer allowed them to do that? And I'll talk about that a little more in a moment. So when we asked young women what they spent the money on, more than 50% said that they spent it on toiletries. So it got spent on toiletries, and then clothing, school uniforms and school supplies, mobile phones and ringtones and various other things that go with mobile phones, and makeup. But the main spend was on toiletries. Many of the young women talked about sharing their money, and it was really interesting that the people they shared their money with was their female siblings. So a little bit of sharing with male siblings, but overwhelmingly sharing was done with female siblings. We had ideas that some young women might choose to save or invest the money, and there were certainly young women who talked about putting money aside so that they could go to university, but it was mostly phrased in, yes, I've got great plans to save the money, I'll start doing that soon. But most young women didn't save the money. This young woman was a particular exception, because she recognized that the area that we did the intervention in had limited infrastructure in terms of ATMs and banking. So we actually got young women to open bank accounts with the post office, because there were post offices in all the little villages, and the post office didn't charge a banking fee, whereas the banks did. And so we got girls to open post office accounts. But this young woman realized she had to travel to Tulumahashe, which is one of the bigger towns in the area, to withdraw the money. And she said, I was losing money every time I went to get it. And so I decided I would take the money and I would invest it in a small business, because otherwise I was throwing my money away. But she was really quite rare. There weren't many women who talked like that. So as I mentioned, there was a lot of concern about giving adolescents money. And one of the big concerns in the community and in sort of departments of education and departments of health, when we talked to them about the project, was that young women were going to spend the money on drugs and alcohol. And what came out in the interviews and the surveys, and I'll just mention that the surveys were done using a CASI, so audio computer-assisted interviews, to try and reduce any reporting bias or social desirability bias. But we had almost no reports of young women spending the money on what we called negative goods like cigarettes or alcohol. And indeed, there was a perception across the intervention young women that they had a responsibility to spend this money wisely, that this money had been given to them because of education, and I think it was because it was tied very, very much to the condition of school attendance, and that the money should be used for good things only. And so that was really not something that was reported. So when we looked to asking young women about what this money meant for them, what did it signify, and what did they feel that it had assisted them with, One of the key messages that came out was that it had facilitated their independence from their parents, and particularly their independence from their mothers. So what young women talked about was a fact that they knew that their mothers were struggling financially, or their families were struggling financially, and yet they felt compelled to ask for money because they had wants and needs that were part of this sort of consumer materialist bent that South African youth society was sort of tending towards. And while they recognized that their families couldn't afford the needs and the wants that they had, they still felt compelled to ask for them, and that it caused a lot of tension between them and their mothers. And so just as a context in this area, the vast majority of households in this area are female-headed, either because they just are female-headed or also because of the cyclical migration, that the male head of household is often not there for the vast majority of the year. So very significantly for young women that this brought them their independence from their parents. And there was some discussion with some young women who said that being financially reliant on your parents meant that they could control you. And we had one young woman who had a particularly difficult family background. Her father had died and her mother had remarried, and there was tension between the children, who were all her mother's children, and their new stepfather, and a lot of financial concerns in their family. She reported going to bed hungry often, and the perception that she and her siblings were a financial burden to their parents. And what she said was, if someone gives you the money, they can shout at you every night and every day. And she said, this money has meant that I no longer have to live under my stepfather's thumb because I've got my own money, and he doesn't control me anymore. Much less than the discussion of independence from parents was a discussion of independence from sexual partners. And obviously this is one of the mechanisms that we'd hoped might protect young women from HIV risk. Although bearing in mind both at baseline and in the final survey, in the final outcomes survey, transactional sex was only reported by 15% of young women. And we tried to do a really broad definition of transactional sex, so it's not were you paid for having sex, but it was were you given gifts, were you given money, were you supported in any way, really to make it quite broad. And with that, still only 14% reported transactional sex, but there was very much a social norm of gift giving within relationships. And so it's an expectation that when you're in a sexual relationship, your partner will provide you with gifts. It's not as direct as an exchange for sex, but there is certainly the expectation that if I am buying you gifts, you will have sex with me. And that's a social norm, which I don't think is restricted to South Africa, and certainly not to this community specifically. So there was much more limited data in our qualitative interviews around how this money might have facilitated greater independence from partners. And really, young women didn't talk about it very much at all. They spoke about it in very broad general terms, that having access to money might release you from a greater dependence on sexual partners, but very few personal stories or young women specifically talking about how that had happened for them. And so we've embarked on some further qualitative work. So this is some of Nontle's PhD work, where she collected, she used the focus group discussions that we'd done with male peers, and then she recruited male sexual partners through young women in the study to further discuss this issue. And in those interviews, the men certainly talked about a change in the gendered power dynamics of relationships. That they said previously they felt that they held the power in relationships because men were more likely to get work in this community, so they had access to money. Women didn't have access to money, and so they had power and they were desirable sexual partners. In particular, young boys who were at school with the young women, so their same age peers, talked about having lost power in terms of being attractive and having relationships with young girls. They said that young girls looked at them and went, yeah, I've got my own money, I don't need this one's pathetic amount of money, I can do this on my own. And they felt that they'd lost out on sexual relationships because of the project. And then we have another colleague based in the US who's done some additional qualitative, some post-intervention interviews where she's really quite explicitly explored how young women felt different elements of the program might have impacted on their sexual behavior. And we're in the process of writing that up at the moment. But really what her data showed was that Access to the money allowed young women to be more choosy about who they had relationships with and whether or not they had relationships, but it wasn't really a mechanism to allow them to leave relationships. It didn't seem to extend to that. So it gave them choice in going into relationships rather than power to leave relationships. But I think that the really interesting component about that was, although women did ascribe some of that power to the money, a lot of it was ascribed to some of the sort of trial processes that we had to go through. So we're doing a randomized controlled trial where HIV incidence is our endpoint, and so every year we were testing young women for HIV, and we were doing pre and post-test counseling. And so young women talked about the fact that they learned about HIV and that they accessed tests, and so they knew their HIV status. They'd overcome that sort of burden of not knowing what their HIV status was. And certainly many of the post-intervention interviews, young women were educated enough afterwards to say to their partners, well, I've had my test now, I know I'm negative, your turn, let's go down to the clinic. And so it certainly increased discussion about testing and testing of male partners. But obviously that wasn't the intervention, that was the study process. So yeah, it's quite hard to disentangle the two from each other, and particularly in our participants' minds. Another issue that young women spoke about really strongly in terms of what the money meant to them was an idea of enhanced peer status and the development of their identity as an individual. And that was really around two key issues. One was cleanliness, and the other was visible resources, particularly school uniforms and pocket money. And I guess that the school uniform and the cleanliness really overlap a little bit as well. So it was a universal theme across all these interviews that we conducted, was that young women wanted to have better lives than their parents had had. So obviously their parents had come through apartheid, where they had been systematically stripped of rights and opportunities. And these were young women who were living in a new democratic South Africa, and they strongly believed that they had the capacity to have better lives than their parents had had. And their better lives were symbolized by having a career, access to their own money, owning their own home, and then coming back and assisting their families and their communities. And all young women spoke about, my parents have had it tough, my parents have had a hard life, my life is going to be better. Because I'm going to do all these things. And yeah, as I've mentioned already, just a reminder that these were not wealthy families, 80% qualifying for social grants and 30% reporting food insecurity. So despite the fact that schooling is free in most of the schools in this community, or all of the schools in this community, schooling was free, many young women spoke of not going to school because they were dirty, and they felt ashamed and humiliated. And that they were mocked and teased by their peers for being dirty, but also for not having a decent-looking school uniform, that they wore worn school uniforms. And so I think that this is one element that seemed to be really significant for young women in terms of the money. The second part was this idea of visible resources. And it was interesting, it was not something that we picked up on in the quantitative surveys, but certainly in the interviews, young women talked about the value of having pocket money. And it was being seen to have the resources, being seen to have resources. And this pocket money is really small amounts of money, is 20 cents, 50 cents in Australian terms. But all the schools are surrounded by fences, and the fences get locked during school hours, and so children can't leave school without permission. And so one of the ways that women have developed an informal economy in these communities is that they sell snacks, chips and sweets and things on these fenced peripheries, and they pass the money through the fences. And so it was it was significant for young women to have the resources to be seen to be going and spending pocket money on chips, basically. And young women who came from particularly poor households mentioned that this was noted about them. You know, this is a young woman who doesn't have pocket money, her family can't afford pocket money, and it made them feel ashamed. So it's about chips, it's not about Gucci shoes or anything, but I think it does talk a little bit towards the influence of increased materialism in young South African society, which authors such as Leclerc Madlala, who has done a lot of work in HIV prevention and in youth issues in South Africa more generally, have discussed, particularly in the context of transactional sex, and talked about this idea of increased materialism and how it impacts on young women's identity formation and their place within the peer network. And so visibly limited resources impacted on young women finding their place in their peer networks. And when they did have access to resources, as I mentioned when we talked about the items that they spent their money on, they overwhelmingly spent their money on items of symbolic capital. So other than the cash transfer, opportunities for young women in this environment are really limited in terms of earning an income. And there's literature that shows that the degree of independence that having access to income or having access to money engenders depends on the source of that income. So it's actually not as good to get money from your parents as it is to earn your own money or to have a way of getting your own money. And so the cash transfer filled a gap for young women in this environment where there actually weren't other resources for them to get their own money. This is not new. It's not new information. There's certainly data from other African countries which have talked about the ability to improve your personal appearance being viewed as vital in adolescent participants. But I think that our data also reflects changes in the way we think about economic need among adolescents. So when we first started talking about transactional sex in HIV prevention, transactional sex was about abject poverty. It was about shelter and food. And what we're recognizing more and more is that transactional sex, where it does exist, an exchange of sex for goods, is really much more about the symbolic access to material goods. And so it's not that a young woman needs to be able to go to the hairdresser and have her hair braided, but that it is part of her identity and part of her place in the peer network. And so it's she perceives it as a need, whereas we might think, oh, well, this is not a need. This is not a life and death situation. And so we have another student she's completed her PhD a while ago, actually, and who worked on the project. She's based at the London School of Hygiene and Tropical Medicine. And Meghna Ranangathan, she looked at transactional sex in this cohort of young women and did a range of qualitative work with them, particularly talking to them about what it means to have needs and what it means to have wants, and where those needs and wants come from and how you facilitate getting them in the formation of your identity as a young woman. So that's where I'm going to stop. I realized that I really didn't talk about the community mobilization at all. Because when I started, I had this grand idea that I was going to walk you through all the qualitative data that we collected from that study too, and I realized an hour is only an hour, and I wouldn't have time to do that. So that's where I'll stop for now.
Thank you very much, Catherine.
Sure.
The way we have the sound organised here is you need to actually speak into the mic for it to be recorded, so it seems slightly odd because you don't actually get any feedback. Any questions from anyone?
Thank you very much indeed, Catherine. I remember those days when people said that education was a social vaccine. And those of us who have our background in education had no idea what was meant by that, because there are so many things that take place within education. We were intrigued to know which elements of the educative experience or of schooling, maybe not of schooling, but of education more generally, was the crucial factor. And then, and I also remember the debates about cash transfers. And what it was about the cash transfer that would produce the desired effect. It was the same conundrum.
Yeah.
What was the social mechanism within education or within cash transfer that produces the determinate outcomes that we might desire in the context of HIV prevention? Now, I'm just wondering, 10 years on, because this study's been going on for a long time, have you any thoughts about that? I mean, what is it about education? What is it about giving money that does it?
Yeah, and so I think one of our plans when we started this qualitative cohort, I can even remember the slide. We had education on one side, and we had reduced HIV risk on the other side, and we had a box in the middle, a big black box, and it said the black box of education. What is actually going on in there, and will we be able to answer it? And I don't feel like we did answer it from this study, and I'm not aware that anybody really definitively has answered it. I don't think it's about HIV education. HIV education is a necessary precondition for knowing about HIV and for preventing HIV, but I don't think it's about that. There's various ideas that have been put forward. I mean, one of them is that when young women are in school, they are more with their same-age peers than they are with older men. Their time is taken up with same-age peers more than older men, and might that be part of the reason why they're less at risk of HIV infection? There's also ideas put forward that young women who are at school are busy, their time is occupied, so they're not sitting at home bored and thinking, well, I have nothing to do on a Tuesday afternoon, I'll go and have sex with someone. So there's that, that's been put forward as an idea. We also had a student who did a little bit of work looking at whether sustained involvement in education led to greater hope in the future, and whether hope was possibly sort of part of the mechanism that explained why education might have something to do with preventing HIV. I don't think we know the answer, and I don't believe we know the answer for the cash transfer either, because I think it would be really clear, if we started out with 70% of young women reporting transactional sex, and at the end of it, girls were saying, oh, I've got my own money, we're now reporting the 14% that we did report. I think we'd be able to see a clear relationship there, but from our data so far, we haven't seen anything that unpacks that sufficiently to explain those things yet. Yeah. But it's a great question.
Any other questions?
I know that you're concentrating more on the qualitative side, but I'm just curious, what was the reduction in incidence with the different interventions?
So there was none. So we didn't see a difference between the intervention arm and the control arm.
Okay.
We actually had more HIV incidence in the intervention arm, slightly more, not significantly more, but we actually had slightly more. Yeah.
Did you see any change in risk, maybe not in incidents, but did you see any change in risk behaviours, like before and after the intervention?
Yeah, so we saw, I have to look at my notes and remind myself, but we saw increased protected sex. So young women who were in the intervention arm were less likely to have unprotected sex. And I have to remind myself about the other ones. There was less experience of intimate partner violence. So it was less likely to report intimate partner violence in the previous 12 months and less likely to report unprotected sex in the previous 3 months. Those were the main sexual behaviour outcomes that were significant. Yeah.
Sue Kipax, I've just got really a comment. It's something that's worried me for quite a number of years, and it's that whether you think, not whether, but whether you have any thoughts about that focusing on young women all the time somehow positions women as vessels of disease.
Yep.
And that men have to protect themselves from women. And I think in the era of PrEP, one of the things that really, really worries me is that there's all this talk about giving PrEP to young women in Southern Africa as though men are completely absent. And I remember asking someone at a conference a few months ago whether he thought women gave HIV to each other. And he looked at me very strangely. But this constant pressure on women to be the ones that are focused on and have to be educated and get money and now get PrEP.
Yeah.
Just like your comment.
Well, I agree. And I mean, the reason that we do it, things like PrEP is because we know young women are so fundamentally at risk. But wouldn't it be better to be addressing the structural issues that make them fundamentally at risk rather than focusing PrEP on them? I mean, I agree with that. And I find it really interesting that so often, particularly in the Southern African context where we have really good antenatal testing because of prevention to mother-to-child transmission, that it's so often the woman who gets tested. So she's identified as being HIV positive in a relationship, often much more frequently than the man is, and she's often perceived to have brought HIV into the relationship. And we know that that's not the case. And I think that there is all this talk about what about the men, we need to focus on men, but I think it's really interesting. My perception is that really the focus has been on how can we help men? Because women have access to all this HIV diagnosis and care through the antenatal system, whereas men are so much less likely to to access healthcare. And so we know that men engage, they initiate ART therapy much later than women do. They're less likely to be compliant and all those issues. But yes, it does seem to be that when the focus is on men, it's on treatment, and the focus for prevention is so much on women. So I mean, what I didn't talk about was the community mobilization work, and that was really focused on men and looking at gender inequalities. And it's a pity there wasn't time, because there's some really powerful work we worked with an organization called One Man Can, and One Man Can works in South Africa and a range of other African countries, and their particular focus is on men, and is on the fact that sort of normative ideas about gender and masculinities are damaging to men and to women, and they're fabulous. I think their work is really what you need, because it does it talks to men about these social norms that we have. They're not just about benefiting you, they actually have costs to you. And so there was that whole element of focusing on the men as well, which I didn't have a chance to talk about. But I agree with what you said, yeah.
Thanks, Catherine. Martin Holt, CSRH. So this is kind of a big question, like this extraordinary kind of study and so much work and effort, and then you get mixed findings, as so often the case with these large, bold studies. What then happens? So there are some positive elements, not entirely what was intended.
Yeah.
Do any of those get carried forward? Do they actually get implemented, or does the whole thing kind of stop? Or what happens then at the end of something like those two large studies?
Yeah, so certainly, so we weren't the only study that looked at cash transfers for HIV prevention. There was a big study that was done in Malawi, and that one, because it looked at HIV prevalence rather than incidence, was one of the reasons that we did our study looking at incidence. There was another South African study, which I don't actually know if the results have ever been published, because they also had a negative finding, and I've certainly not seen a publication that's come out of that. I certainly know that cash transfers are still being talked about, and I feel like the sort of impetus going forward with prevention for young women is very much about, it's not just about HIV education, it's this whole, we need a package. And so, the DREAMS program and things like that are going ahead, which are saying we've got to look at individual issues, we've got to look at structural issues, we've got to look at providing PrEP. So I feel like they are still being talked about, but I also feel like I'm a little bit out of the loop, because I've now been in Australia for 6 years. And this work, probably in the last 2 years, my involvement in this work has dropped off fairly significantly as it's come to an end. There's not a huge call for HIV prevention work in young women in Australia. So I'm sort of focusing my attention on other things. But I feel like cash transfers had their sort of time where they were going to be the next solution to HIV prevention. And we started this study at a time when there was that sense. And my sense is that there's certainly recognition that we need social protection for a range of other reasons, but that the evidence at the moment says it's not going to prevent HIV infection. Well, the ways we have implemented them so far are not going to have an impact on HIV prevention. Yeah.
Be time for just one more question.
Catherine, you talk about how these young women had intimate sexual relationships and were engaged in transactional sex. So there's some literature from Africa and from some developing world settings that tells that the patriarchal discourse that often reinforces masculine dominance and suppresses women's sexual autonomy. Mm-hmm. So did you find anything like if that gender nature of power imbalance impacted women's sexual decision-making in their intimate relationships? And when you talk about transactional sex, so how their financial dependence on transactional sex impacted their sexual decision-making?
So because we found such low levels of transactional sex in this cohort of young women, that's quite hard to answer. When I talked about that, when I talked about the work that Marie Stoner was doing, which I said was the post-intervention qualitative work, what she's been trying to do is to sort of create matrices that look at the different elements of the intervention, money being one of them, but also the various activities that were involved in being part of the trial, and then looking at a range of different sexual behaviors and how women talked about how it might have impacted on their sexual behaviors. That, young women don't say it. I have counted, patriarchal sexual norms in my society, and this is what I'm doing. But they do talk about the fact that they are the ones with the education and the knowledge in their relationship, and that they've leveraged off being part of the study to say, well, I now know about this. I'm the authority on this in our relationship. I've been tested. I know what my status is. And so there's certainly that element. The quantitative data tells us that young women are having less unprotected sex, which, suggests, we can't prove it definitively, that it's young women who are negotiating that the condom use in those relationships. I think it's really quite hard to establish that fact. I think there was definitely a sense of more power and a sort of a feeling of confusion among young men. When we spoke to particularly their male peers, there was this sort of sense of, hey, you guys, you've come in here and you've disrupted my place in the universe. Things have changed and they're not the way they were, and I don't really like it. But yeah, I think that's probably, given that the transactional sex was really low, it's challenging to comment on that from this study in particular. Yeah.
All right, thank you very much. Can we all join and thank Catherine again for coming?